Technique of the passage of soft urethral instruments. Antiseptic preparations. The instruments are sterilized, the operator's hands washed, and the meatus and glands cleansed, as described in Chapter 3. Lubrication. The object of lubricating a urethral instrument is not to make the instrument slippery, but to let it slip through the meatus. A small dab on each lip of the meatus is all that is needed, and this is best applied not by greasing the whole shaft of the instrument, but by transferring a bit of lubricant to its tip and with it smearing the lips of the meatus. Position of the patient. The patient should lie flat upon his back for the first instrumentation, since this sometimes causes marked nervous shock. But for subsequent operations, he may assume any convenient position. Introduction of the instrument. The catheter is readily introduced as far as the bulbous urethra. Up to this point, the urethra offers no obstruction, unless the meatus is unusually small, page 251. But unless the penis is held at right angles to the patient's body, the bend of the urethra at the point of attachment of the suspensory ligament, just back of the penoscrotal angle, offers a slight resistance. At the junction of the bulbous and the membranous portions of the urethra, the catheter encounters the compressor urethrae muscle. This muscle may present a scarcely perceptible obstacle, or it may be excited to reflex spasm of such intensity as to prevent the entrance of the catheter. Method of overcoming spasm of the compressor. When the advance of the catheter is obstructed by the compressor urethrae, the tip of the instrument may lie just within the grasp of the outer fibers of this muscle, or it may pass down into the pocket of the bulb. The first maneuver to overcome this obstacle is to crowd the catheter gently but firmly into the urethra and hold it there for half a minute. On releasing the catheter, it either springs back or remains in place. If it springs back, it may be taken for granted that the tip of the instrument is pocketed in the bulb and does not present at the opening of the muscle. It must then be removed and another instrument selected. But if the catheter does not spring back, it may again be crowded against the muscle in the hope that a slight advance has been made and that further pushing will finally overcome the spasm. The second maneuver is to select an instrument that will present its point accurately at the orifice of the muscle and have sufficient rigidity to overcome the spasm. The best instrument for this purpose is the natural curve woven catheter. It usually slips readily into the posterior urethra. The third maneuver is to aid the passage of the woven catheter by gentle pressure upon the floor of the bulbous urethra with a finger against the perineum, while with the other hand the catheter is gently pushed forward. The fourth maneuver is to replace the woven instrument by a metal one, and to pass this according to the rules laid down below. If properly performed, this maneuver always succeeds. Method of passing the neck of the bladder. When a flexible catheter has passed the compressor muscle of a normal urethra, it enters the bladder without further difficulty. But if the catheter stops, we know that at its point has caught in the floor of the prostatic urethra in front of the internal sphincter. It may be lifted out by pressure with the finger introduced into the rectum.